Did you know that with just a glance from your doctor during a routine checkup, they can detect warning signs that you or a loved one is suffering from a dangerous disease without even knowing it? The scariest thing is, those signs are not in complicated tests or modern machines, but in seemingly harmless daily habits. The way you brush your teeth, how often you shower, even the color of your toenails. And if you're over 60 or caring for an elderly parent, this could be the most important video you'll watch this year. I'm going to share with you 7 personal hygiene mistakes that seniors are prone to making, and why doctors always spot them right away. This isn't just about cleaning your body. This is your body's way of silently calling for help, sending out the earliest signals before disease breaks out. You will learn why an old toothbrush can be linked to a heart attack, why bathing less is not just a personal choice but can hide signs of kidney failure, and why a little bit of shyness about urinary incontinence can make you miss the opportunity to treat prostate cancer at an early stage. And especially in part 4, I will talk about the mistake that more than 50% of seniors are making in silence. A mistake that, if not corrected in time, will make life lose both comfort and dignity. Don't take your eyes off this video. Every minute that passes can be a year of health saved. You may be thinking, I am still healthy, still living normally. Are these things really necessary? But it is this subjectivity that has caused millions of elderly people in the world to enter the stage of serious illness without realizing it. Because most serious health changes in the elderly do not start with obvious pain, but start with small signs that are overlooked, even in daily hygiene habits. The point is, this information is rarely mentioned in regular health checkups, and even less often appears in popular articles. But they are the things that internists, cardiologists, and geriatricians always look for first when meeting elderly patients. In this video, you'll not only be warned about the mistakes that are happening every day in millions of households, you'll also be guided through easy-to-implement, low-cost solutions that can help detect many dangerous diseases early, such as diabetes, heart disease, infections, and even cancer. Remember, this is not common knowledge. It's a collection of expert experiences drawn from thousands of real-life cases, validated by research from prestigious medical organizations such as Harvard Medical School, Mayo Clinic, Johns Hopkins, and the American Geriatric Society. And if you're caring for an elderly loved one, or you're at an age where you need to pay more attention to your health, the information about to be shared will not only help you prevent disease, but also preserve your independence, dignity, and quality of life for the rest of your life. Don't watch this alone, because below, we're going to dive into the 7 most common mistakes, and you'll see at least one of them happening right in your own family. Mistake 1. Neglecting oral care, the silent enemy of the heart and memory. When it comes to taking care of the health of the elderly, few people think of toothbrushes. But did you know that an old toothbrush with frayed bristles or a poor brushing habit could be paving the way for bacteria to attack your heart and brain? Many studies from Harvard have shown a direct link between gum disease and the risk of heart disease, stroke, and dementia. When bacteria from the mouth enter the bloodstream through damaged gums, they can cause inflammation of the blood vessels and lead to dangerous complications. Sylvia, 68, a retired teacher in Oregon, thought bleeding gums were normal in old age. But during a routine checkup, her cardiologist discovered inflammation of the heart valve caused by bacteria from her mouth. I brushed my teeth every day, but I never paid much attention, she said. If not caught early, her heart damage may have been irreversible. The solution: replace your toothbrush or electric toothbrush head every 3 months. Brush your teeth twice a day for at least 2 minutes each time. Floss every night. No exceptions. See your dentist regularly, even if you wear dentures. Don't wait until your teeth hurt to take action. By the time your teeth start to speak, your heart may already be damaged. Mistake 2. Reduced bathing frequency and hiding important signals on your skin. Many older people gradually reduce their bathing frequency because they think that less exercise means less frequent cleaning. But what they don't know is that the skin is the largest organ in the body, and one of the first mirrors to reflect the state of the inside: the liver, kidneys, heart, and even the endocrine system. Clarence, 77, of Michigan, only bathes once a week because he fears his skin will dry out in the winter. During a visit to the doctor for chronic fatigue, he noticed an unusual grayish tinge to the skin under his arm. Tests later revealed that Clarence had early-stage kidney disease, and he had no other obvious symptoms. The solution: bathe at least 3 times a week. using warm water and mild soap. Moisturize immediately after bathing while your skin is still slightly damp to retain water. Check your skin regularly. Look for dark spots, dry patches, sores, or any changes in color or feel. Don't let your skin be a barrier to early detection. Mistake 3. Neglecting nail care. A sign your body is crying out for help. Doctors can tell more about your fingernails and toenails than you might think. From anemia, thyroid disorders to infections or weakened immune systems, all can be present in the thickness, color, stripes, or cracking of the nail. Beatrice, 82, hid her feet in shoes for years because of thick, yellow toenail. Thinking it was just a common fungus, when the pain became unbearable, she went to the doctor and was diagnosed with a severe fungal infection that lasted for a long time, along with a severe immune deficiency. She was later found to have an underlying blood disease that could have been detected earlier. Solution: trim your fingernails and toenails regularly. Cut straight across, not pointed, to avoid ingrown nails. Clean the underside of your nails and between your toes thoroughly. Don't ignore the signs: discolored nails, abnormal thickening, brittleness, cracking, or pain when walking. See a dermatologist or internist if you notice any persistent changes. Nails are more than just a cosmetic item. They are a silent warning from inside your body. Mistake 4. Hiding incontinence and covering up dangerous conditions. Nothing makes older people more embarrassed to talk about than losing control of their bladder. But this is also the most dangerous mistake, because it causes many to hide conditions that can be effectively treated if detected early, from urinary tract infections to bladder prolapse to prostate cancer. Douglas, 73, of Arizona, used tissues and changed his underwear continuously in silence for more than a year. He thought he was dealing with the problem until painful sores appeared on his sensitive skin, and his doctor discovered he had a form of acute prostatitis, which had progressed without being diagnosed. The solution: don't be embarrassed. Be honest with your doctor at the first sign. Use a specialized product for incontinence. Never use toilet paper or poorly absorbent materials. Clean thoroughly after each change, and moisturize the affected area. Monitor the frequency, amount of urine, and any accompanying abnormalities: painful urination, blood, strange odor. This condition is not a thing to endure with aging. It is a reminder that you should start proper treatment. Mistake 5. Cleaning your ears the wrong way, causing damage and missing signs of serious infection. Are you using cotton swabs to dig deeper into your ears every day? If so, you're not alone. But like millions of other seniors, you're inadvertently pushing wax deeper into your ears, damaging your ear canal, and even rupturing your eardrum. Patricia, 71, used to clean her ears every night before bed as a habit, until one day she felt a sharp pain and lost hearing in one ear. At the hospital, doctors determined that her eardrum had ruptured due to mechanical impact, and an infection had spread to the surrounding tissue. Patricia had to undergo long-term treatment and lost some of her hearing permanently. But more importantly, many dangerous conditions in the elderly, such as middle ear infections, auditory neuritis, and even ear tumors, can start with a feeling of itching, fullness, or hearing loss, which is often mistaken for too much earwax. Solution: never put anything deep into your ear, including cotton swabs. Only clean the rim and outside of the ear canal with a warm, clean towel. If you feel itchy, ringing, smelly, or have hearing loss, see an ENT specialist. You can use specialized eardrops to soften earwax, but only follow clear instructions. Clear hearing is a condition for communication, for connecting with life. Protect your ears before it's too late. Mistake 6. Neglecting your feet, a reflection of your cardiovascular and nervous health. Have you ever really looked closely at your feet recently? Between the toes, heels, toenails, or the feeling when walking? Because the fact is, the feet of the elderly are a warning map of the health of the whole body. Endocrinologists and neurologists agree. Diabetes, circulatory disorders, venous insufficiency, and peripheral nerve damage often start with small changes in the feet, but people rarely notice them. Raymond, 76, of Illinois, had suffered from dry feet for years, along with cracked heels and a few small cuts. He applied cream out of habit but didn't get it checked out. When his doctor accidentally discovered a non-healing sore during a routine checkup, tests revealed that he had been secretly suffering from type 2 diabetes for years. The solution: wash your feet every day with warm water and mild soap. Dry thoroughly, especially between the toes where bacteria and fungi thrive. Check your feet daily. Look for cracks, discoloration, swelling, or unusual numbness. Don't apply lotion between the toes. It can trap moisture and encourage fungus. See a doctor immediately if a wound doesn't heal after a few days. Taking care of your feet is how you keep your heart, nervous system, and endocrine system listening. Mistake 7. Ignoring hygiene changes due to medication side effects. A silent warning of poisoning. Have you noticed that after starting a new medication, you sweat more than usual, have a strange body odor, or have a constant dry mouth? These seemingly minor changes can be early signs of serious side effects. Barbara, 67, is a retired nurse. After being prescribed a new blood pressure medication, her family began to notice a change in her body odor. She continued to shower regularly and use perfume, but there was no improvement. When she went to the doctor, tests showed that her liver enzymes were abnormally high, and the main cause was the accumulated toxicity from the medication. Researchers at the American Geriatric Society say that nearly 40% of serious side effects from medications in older adults start with changes in personal hygiene. Bad breath, unusual sweating, dry mouth, mild rash, or changes in body odor. The solution: keep a record of any changes in body odor, sweating, skin, and breath after taking a new medication. Do not adjust the dose or stop taking a medication on your own. Check with your doctor. Drink enough water as directed to help metabolize the medication. Get regular checkups to monitor liver and kidney function and drug reactions. Be especially careful if you are taking 3 or more medications per day. Medications can save you, but they can also harm you if you don't listen to your body's early warning sign. If you've made it this far, you've probably noticed something. Small, seemingly harmless daily habits are the first signs that your body is telling you something. Not brushing your teeth properly can open the door for bacteria to attack your heart and brain. A delay in showering can hide signs of liver disease or kidney failure. Thick, yellow toenails may not just be a fungus, but a warning bell for a weakened immune system. And being embarrassed to talk about urinary incontinence can sometimes be the reason you miss out on early cancer treatment. The most important thing to remember after this video is personal hygiene is not just about being clean. It's part of an early warning system that helps you detect disease before it develops silently. When you maintain proper hygiene, you're not just taking care of your appearance, you're creating the conditions for your body to be detected, protected, and live longer. So what should you do now? Start by checking in with yourself, gently but honestly. Look at your toothbrush, your fingernails, your feet, your skin, your ears, how you feel when you go to the bathroom, and any changes you've noticed since you started taking the medication. Take notes if you need to. If you notice anything unusual, don't delay. Talk to your doctor. Don't be shy. Don't wait. And if you live with an elderly parent or have a loved one in retirement, share this video with them. You might just save a loved one's life just by sharing the information at the right time. Finally, if you found anything I've shared today valuable, leave a comment below. Have you experienced any of these issues? What did your doctor discover by observing seemingly simple habits? I'd love to hear your story. Who knows, you might be able to help someone else who needs answers. And don't forget to subscribe and turn on the notification bell. We'll have more topics on how to stay healthy, active, and smart as you age. You don't have to fear aging, you just have to prepare for it the right way. Starting today.